This is a 5-minute discussion evaluating the standard in which a randomized controlled trial is conducted, which involves a skin cancer screening test. This test was a 2-step test conducted in Germany in 2003, which addressed malignant melanoma and non-melanoma skin cancers. Citizens aged over 20 years with statutory health insurance were eligible for a standardized whole-body examination, which took place in a 12-month study period. Cancer registry and mortality data were used to assess these effects. Of the 2.8 million inhabitants, there was only 1.88 million of who fit the eligibility criteria. Only 360,288 of these candidates were readily available participants when screened during this period.
The criteria stated that participants had to be 20 years or older and a policyholder of statutory health insurance, which applies to approximately 85% of the German population. The randomization of the trial included groups of ages 20 to 34, 35 to 49, 50 to 60, and upwards of 70 years of age, with each group containing a male and female counterpart. Statistically, malignant melanoma is more often diagnosed in women, where more men are given the diagnosis of a squamous cell carcinoma. Of the 360,288 screens over the 12-month period, 1,181 females and 461 males had a personal history of MM, and only 13,832 women and 10,203 males were at risk of NMSC, as well as up to 30 other variables during the trial.
Of the 1.88 million eligible cases, only 288,000 were screened. Of these patients, it's unknown if any were omitted. Melanoma incidence increased 34% during the year of the study. However, in the following 5 years after, melanoma mortality was reduced by over 50%. Any loss in follow-up checks can bias the results. All patients and investigators were aware of the treatment allocation. Whole body examinations were conducted by dermatologists in case of risk factors, suspicious lesions, or both. This assessment is objective, so blinding of health screening is less critical. However, in cases of detected malignancy, follow-up examinations were taken by the dermatologist, where a biopsy specimen was conducted, followed by a histopathological examination. Here, the outcome is subjective, so a blinded or placebo treatment would have been more ideal.
A 95% confidence interval for incidence and mortality rate was calculated in the study, which shows that the results are statistically significant at the 0.05 level. This public health screening process is significant in chiropractic clinical practice because of the mortality rate of skin cancer is high if left undetected. Early diagnosis is proven to drastically reduce the rate of deaths directly related to skin cancers. Due to Queensland being the skin cancer capital of the world, it is highly relevant that chiropractors in this state have a specific knowledge of what to look for when examining a patient and if skin cancer is present. A referral can then be made by the chiropractor to the relevant healthcare professional. This concludes our examination of a skin cancer screening study and the impacts it can have on a chiropractic clinical practice. We hope you have enjoyed our presentation.